Hey guys, so in today's video, I wanted to share with you how my first week back at work went. So for those of you who don't know, in June of 2024, I had weight loss surgery. I had the vertical sleeve gastrectomy, otherwise known as gastric sleeve surgery. And today, as I am filming this, it is July of 2024. Tomorrow will actually be 3 weeks since I had my surgery. And so, for those of you who also don't know, prior to surgery, I was working full time in the sleep center. When I returned back to work, I switched my jobs. So, I am now working full time as a medical assistant again in the urgent care setting. So, still at the same hospital, just in a different role. And so basically, the first day that I went back to work, I only worked 4 days this past week because on Monday, I actually had my post-op, my 2-week post-op appointment. So I had to wait to get clearance to return to work, which it ended up being that my surgeon actually didn't even see me that day. So I had to email the office to get a note to release me back to work because I was supposed to be seeing my surgeon and the dietitian. Well, the surgeon didn't show up, but the dietitian did. So I had to get a whole work release note and all of that. But I got that. So on Tuesday, I returned to work and we only had 7 patients on Tuesday. So that was kind of like the trickery. We'll call it the trickery because if you don't know, urgent care can be very, very unpredictable. It's one of the things that I like about working in an urgent care clinic because you never know who's going to walk in with what. We do a lot of injections, allergy injections, antibiotic injections. B12 injections. We do injections of like psych meds or Suboxone injections. So any of those things can walk in the door at any time, plus any patients who need to be seen, who either can't get in with their primary care doctor or need some help like now, like they injured themselves or something. So, like I said, on Tuesday, we had 7 patients, so it was very deceptive. That is totally not a normal day whatsoever. Like, even on the weekends, I'm surprised when we only have 7. And so it threw me off when we only had 7 patients for a Tuesday. Normally, Mondays and Fridays tend to be the worst, or the day after a holiday tends to be the worst, even though our urgent care clinic is open every day of the year. Even on holidays, we are open. So yeah, I don't know why it's always so busy the day after a holiday. It's like everybody just waits and comes in. But anyway, it wasn't a holiday, but Tuesday was okay. It gave me a chance to kind of ease my way back into things. It gave me a chance to get my desk set up again with all of the things. And then Wednesday, we saw over 30 patients. So I was running around like a chicken with my head cut off. The provider that was covering the clinic, the urgent care clinic that day, she only likes 2 people to be brought back at a time. So when the rooms were full, those 2 rooms, that's where we stopped. The other nurses were asking me like, hey, do you want me to room somebody for you? And I was like, well, I have 2 people back, so the other people are going to have to wait. Because that specific provider, she does not like to have more than 2 people back at a time because, like she says, and it makes sense, she says, I can only see 1 person at a time. And also, like, except for on Fridays, we only have like 2 rooms available to us. So it kind of makes sense to only bring back 2 people at a time because the way that the clinic is set up, like on days when all the providers are there, we don't even have any rooms for clinic patients. So we kind of have to check with other providers, nurses, and see like, hey, can I use this room for a clinic patient? Like, we have to ask to try to find a room, which is really frustrating. And I hope when they finish the renovating that they have taken that into consideration and given us our own dedicated rooms. And then on Thursday, well, on Wednesday night when I came home from work, I was so exhausted that like I fell asleep super early, and I had a feeling that it was going to be rough, but I didn't know that we were going to have like over 30 patients, because that is a lot even for the urgent care clinic during the week. And, on the one hand, I really liked being able to, constantly be up and moving, because I kind of missed the busyness aspect of things, which sounds weird to some people, but I kind of missed, getting up and going to do things instead of just sitting at my desk all day, which is what I did up in the sleep center. Um, but yeah, I fell asleep super early. And then Thursday, we saw like 18 patients, which that's a semi-normal day for urgent care. So that was okay. Some of the stuff that like people came in for was crazy. Like, I kind of want to make a list of everything that people come in for a week, and see like what, just to tell you guys like what kinds of things we see. There was a day when it was like people with like most of the people that came in had ear problems. And then there was another day that most of the people that came in thought that they had UTIs or some other similar problem. And so, yeah, it's just crazy how it's like they come in droves with the same issues. Skin issues and pain and dental pain, and like it's just kind of crazy to see what one day is going to be majority of types of patients, if that makes sense. So the only thing that really concerned me, oh, on Friday we saw about the same number. It was like 17. It wasn't too bad. Like, the morning was kind of go, 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 go. And then the last hour or so, we only had one patient. So that was fine with me. But yeah, so on Wednesday, I actually ended up hurting myself, because even though my surgeon's office did release me with no restrictions, I still obviously have recently had surgery and have to be careful. And there was a patient who weighed well over 350 pounds and needed to be pushed down to x-ray, which really kind of frustrated me, because as soon as I brought this patient back, I couldn't fit the wheelchair into the room that was available for this person. And so as soon as I brought the wheelchair to the doorway, I'm like, oh, I don't think I'm going to be able to fit the wheelchair in the room. This person just stood up and walked with no limp or anything to the chair in the room. And so it really frustrated me, because after that, my abdomen hurt for like 2 days. And like it hurt worse the first day after doing that, but then like the second day after, it was really sore and like tender, and even like doing a bending over motion would hurt. Like, it doesn't now, that's why I just did that, but I couldn't even do that for a couple days after that happened. So I don't know, it was a crazy first week back. This upcoming week, I actually only work 4 days as well, because tomorrow I have to go see my neurologist. For those of you who don't know, I do have a seizure disorder, so I do see a neurologist every 6 months. My seizures are currently under control. I don't even remember the last time I had a seizure, so that is good. So this appointment really frustrates me, because it's telehealth and I have to drive over an hour to go see him. But yeah, anyways, that's another story for another day. But yeah, that was my week back, my first week back. Even though it wasn't a full week. Let me know if you guys would be interested in seeing like, or hearing about the different things that come into the urgent care clinic for the whole week. I could do like, if we get 30 patients in a day again, I could do for that like whole day, or I could do for an entire week and just kind of keep track of what people are coming in for. Honestly, I can't give you guys super detailed information, but I can kind of give you guys an idea of what people are coming in for. And I did do one COVID test on Friday. The lady said that she was with a group of people who, some of them had tested positive, some of them had tested negative. I couldn't even remember my password to run the COVID testing machine that we have in the clinic. That's how long it's been since I've done a COVID test. Because honestly, most of our providers aren't even testing for COVID anymore. They're like, because the treatment for COVID, like the Paxlovid, is not, like, it's very expensive and it's not covered by most insurances anymore. So most people, once they hear the price of the treatment, they're just like, oh yeah, I'll just treat the symptoms. So most of our providers aren't even ordering the test anymore. But yeah, anyways, we tested her and she was negative, so that was good. She was very happy to hear that. But anyways, let me know if you guys have any other topics you would like to hear about. And yeah, I will talk to you guys in my next video.